1 out of 10 patients say, oh, my stomach is good. And maybe 8 or 9 out of 10 patients says, oh yeah, I have a stomach issue. Oh yeah, I have a gastritis. Oh yeah, I feel burning sensation. Something is floating, moving, noising, gurgling. That's very common, doctor, as you said. So that's the key. Low acid causing, the gut weak, and then that H. pylori, all the infection grows. Digestion needed more than 5,000 enzymes, need to be active all the time. That is the food. I see a lot of patient comes that, can you save my life? I think I'm going to die in a month. When you have a H. pylori, they control their brain, their control nervous system. People go to the so much panic and anxiety mood whenever high H. pylori. They say anxiety is gone, everything is gone, no panic attack. Oh my God, it's so incredible. Digestive tract problem is so dangerous, so devastating. And then they improve, they become so happy, doctor.
Well, I'm Dr. Noel Boaz. I'm an MD, PhD, and I specialize in human clinical anatomy and evolutionary medicine. I'm very pleased today to have a discussion with Dr. Haque about his approach to dealing with integrative medicine and dealing with the whole patient. We have a few topics today that I think quite timely in looking at issues that patients around the country and in fact around the world are dealing with.
Correct.
Dr. Haque, it's a pleasure to be with you today.
It's so wonderful, Dr. Boaz, meeting virtually, and we're going to discuss such important topics. And it's so happy and it's a pleasure to speak with you today.
It's a pleasure to be here. Now, I have a number of topics that you've sort of indicated are of great interest to your patients, and then we sort of... You mentioned a lot about the digestive system and how important that was. And I have a topic here on gastric disease and peptic ulcer, I suppose fits into that. You've touched on a number of these issues already, but that is, I think, if your patients are anything like the patients that I've seen, back pain is maybe number one, and what they call stomach ache is number two in terms of the...
it's more to the patient. Maybe 1 out of 10 patients say, oh, my stomach is good. And maybe 8 or 9 out of 10 patients says, oh yeah, I have a stomach issue. Oh yeah, I have a gastritis. Oh yeah, I feel burning sensation. Something is floating, moving, noising, gurgling. That's very common, doctor, as you said. So we used to know that, hyperacidity, in the stomach. Now we know that it's not actually hyper, it's a hypo. 99.99% patients say that, oh, I have something gas coming out. I have too much acid in my stomach. Acid always comes out, doctor. That's my problem. And very hard someone come with it like too many acid conception. So the true signs in a gastritis and GERD and acid reflux, whatever it is, or peptic ulcer, that root is long time lack of acid in the tummy, because our stomach need very strong acidic environment around 2.5 pH. If some indigestion problem or some inflammation around the digestive organs like a pancreas, intestine, liver, and gut have a inflammation issue, it stops secreting acid that we need to keep right environment in the stomach. And then if that happen, all the opportunity bacteria grow, candida, parasite, they grow, and then H. pylori grow. If they grow, that making more infection in the gut, making a leaky gut. And the cardiac sphincter, the gate of the tummy opened up whenever have infection, whenever have a low acid. So whenever open up the gate, acid comes up and feel the burning sensation. And if go for a long time, and then gastroesophageal problems happen, like inflammatory in the esophagus when a lot of problems happen. So apparently it looks like too much acid is coming up. Actually, too less acid, sphincter lost the sensation. Acid comes up. So what is the solution? Since acid is low, as soon as we give some betaine hydrochloride, or if not too serious, we say, okay, get some apple cider vinegar, 2 scoop with every meal, morning and evening as well. For some, this scare, oh my God, 2 scoop, two tablespoon is too much. I already have too much acid. I said, no, you have less acid. Once you feel acid in regular basis, but stomach will again go back to normal acid level. You won't have a gastric problem. And that's what they feel. In a few days, they get used to the apple cider vinegar, they improving acid level, which is pH getting low, and then they ended up have no gastric problem. So that's the key. Low acid causing gut weak, and then that H. pylori, all the infection grows, and infection moved. If Candida parasite that goes down to lower part gets SIBO or SIFO, and that also constant or continuous basis gastritis problem stay in the body. So for them, again, very beginning, we support with acid, either betaine hydrochloride or apple cider vinegar. We need to give them digestive support enzyme because their body is not producing enzyme anymore. Digestion needed more than 5,000 enzyme need to be active all the time. That is the food. And we need to eliminate all type of processed food because processed food doesn't digest well in the stomach. They need to be live, raw food as much you can, and then healthy fat, more plant-based. Remember, you were asking earlier the vegan diet. For them, need to have some vegan diet temporarily. They would feel better, digest well. And some people have a SIBO and SIFO. For them to control the gastritis or acid reflux or anything, they need to go with a cleansing SIFO, fungal or bacterial infection. That have another protocol we follow. And then, doctor, if someone have a long time effect of this gastric issue, they need to do exercise, meditation, breathing exercise to activate their vagus nerve to bring their body back to parasympathetic tone. Then they get back to normal enzyme, acid, digestion, everything improve. And everyone, if every types of SIBO, C4, or H. pylori have a specific type of herbs that works, and then we're so successful with it. I see a lot of patient comes that, can you save my life? I think I'm going to die in a month. Doctor, do you know that when you have a H. pylori, they control their brain, their control nervous system. People go to the so much panic and anxiety mood whenever high H. pylori. And sad part is, big part of the testing doesn't diagnose H. pylori until it is in certain level. So patient comes H. pylori negative, they have all H. pylori symptom, and our nutrition response testing, muscle testing shows that they have H. pylori, but diagnosis is negative. We support H. pylori, works like a miracle. They say anxiety is gone, everything is gone, no panic attack. Oh my God, it's so incredible. Digestive tract problem is so dangerous, so devastating, and then they improve, they become so happy, doctor.
Well, I was going to ask you about H. pylori because, in the older days, I suppose, well, the last generation, peptic ulcer was pretty much explained on the basis of stress and having too much stomach acid. So it was treated that way to reduce the acid. But you're saying you actually decrease the pH by increasing acid in the stomach. Is that the way? Do you use any antibacterial therapy for the H. pylori, or do you really?
We have
Yeah,
to. But doctor, sometimes H. pylori itself producing high acid. That's some cases too. On those cases, we don't give betaine. Their body don't like betaine. In those cases, we only give digestive support. But when you have a SIBO or SIFO or without H. pylori, they are 100% deficient of acid. And as you said, for H. pylori, we use oregano oil and mostly mastic gum. And then we have a lot of time, most of the time, I see positive muscle test with a mix of mastic gum, oregano oil, along with olive leaf extract. All three together helps to cleanse the H. pylori.
It's interesting. It's a very interesting approach, and I'm interested to hear that you find it effective, because these are complicated cases many times. And I find that with general practitioners who are MD trained, many times these symptoms can be very diffuse, and they can be ascribed to the gallbladder or the pancreas or the ileum. Very complex issue, and many times the pain is not localized. As you know, it's going to be sort of very interesting to hear your approach and your clinical experience.